Which one to use, normal or electric? Expensive. Electronic toothbrushes are not all same, so choosing them randomly can actually reduce their benefit. Type of electronic brush depends on patient's need, dexterity and oral condition. So the three basic techniques in the electronic toothbrushes you will see are oscillating rotating type, sonic and ultrasonic. Ultrasonic are little less common. So I have here Oral-B oscillating rotating toothbrush. As you can see, it is round in head and it moves back and forth. The advantage is it's easy to clean the last tooth with the help of these brushes, because this is the main concern of most of the patient. So its cleaning is good in the last tooth. Another thing is they are having a timer. It is having a 2-minute timer, and after every 30 seconds there is a change in sound, so you will get to know to switch to the other side. A fully charged battery will give you approximately 7 to 9 working days with these toothbrushes. In Oral-B, I would recommend to go for Oral-B Vitality and Oral-B Pro 3, and other than that, Perfora and OraCure are also performing good. I recommend Oral-B because the advantage here is with the same base you can switch to different heads or different advancement in brush heads, so you can place them on the same base model. Cleaning efficiency is more or less same. The basic difference in advancement is like they are having the light indicators or the battery charge indicators, which is not in the base model. Moving to sonic toothbrushes. Sonic toothbrushes works on higher frequency vibrations. So here I have Philips Sonicare toothbrush. With the help of higher frequency, they move side to side. The advantage is it is more like your manual toothbrush, so switching to these brush is comparatively easier. It is also having a 2-minute timer, and once fully charged, it will give you approximately 14 working days. So here you have to place the toothbrush and you have to glide it, and once 30 seconds is complete, switch to the other side. For the sonic toothbrushes, I recommend Philips Sonicare. The reason being because they are using the precise technology. There are different sonic toothbrushes available in the market.
There are some cheaper alternatives.
The drawback is with time there is only movement in the outer bristles. The center bristles are stable, or there is no movement from starting only. So if you ask for the general population, patients with plaque accumulation, or for better posterior teeth cleaning, I recommend oscillating rotating type of toothbrush. Patients with active gum infection or with orthodontic braces, or those who wish to have the less aggressive feel, I recommend sonic toothbrushes. Electronic toothbrush is not magic, but yes, for some people it makes brushing more consistent, more effective and easier. People with excellent manual brushing technique, it is not recommended to switch to electronic toothbrush.